Hi there, Dr. Zac Watkins here, Functional Medicine Practitioner and Clinical Nutritionist, and I have a very important question for you. Now, what is more stuffier than me in this white coat? Now, if you guessed you during allergy season, you'd be right. So this is the time of the year, 2 times of the year, where spring and fall, where allergies are just starting to run rampant. You know, the April showers bring Mayflowers, and the pollen's coming out, so it's a big, big deal. So I get questions about this a lot, about allergy processes and what really goes on. Is there anything else, maybe from a natural perspective, that can be done for allergy and allergy prevention? So I want to show a quick demonstration about basically how allergies work. It's very simplistic, so follow me if you will. So we have basically these triangles are going to be, think of pollen. Think of, you know, pollen in the air, grasses, dander, those kind of things. And when we breathe those in, whether it be through our lungs or our nose or sinuses, those things, we're going to make, our body makes these antibodies, these blue things. Think of little soldiers going after an attack. So antibodies, which you've probably heard of, are IgE antibodies. That's the immediate kind of reaction. Anyway, what happens is they bind to those allergens and danders and those kind of things, and then that complex, this is called an antibody-antigen complex, they bind to these things called mast cells. Mast cells, excuse me, mast cells are in places like, well, like in your lung tissue, bronchioles, and the big place they're located is in the GI tract, in the gut. So when that happens, they bind, and they're through a lot of magical science and confusing physiology that's boring, goes through stuff, and it gives off basically markers, things like histamine, which we've all heard of, and other fancy words called leukotrienes and prostaglandins and things like that. Basically, their messages give off to these mast cells that alert other cells elsewhere about the allergy response. So, and this is what starts kind of triggering the immune response overall. So you're going to get excess histamine production, not to mention the leukotrienes and the things like that. So you're going to develop the typical things that you're probably used to. Swelling and congestion. So these cells give off the messages that basically are going to start causing this. Swelling and congestion, sneezing, itchiness, runny nose, and runny eyes, and those kind of things. Especially itchiness under the skin. That's pretty common. Remember I said histamine, a lot of these things are produced in the gut. So it's not uncommon for people to have major food allergies and things like that to develop high levels of histamine. And that actually gets into their skin. They get itchy. They may have red skin, redness. If you scratch your skin and it really stands out bright, that's an indication that you have high levels of histamine in your system. So typically the response of allergy medications needed in some instances, actually what they do is their job is to pretty much block histamine. So they go to these cells and they block the receptors for histamine, therefore trying to decrease these responses. The problem with that is now you get a buildup of histamine in the body fluid, the body system. It's like you're carrying around a histamine pool, and that's what kind of puts more people again at these more congestion. You get what's called leaky vessels, kind of like leaky gut, but your blood vessels become leaky and you start developing swelling, constriction, pain like in sinuses, and just bad symptoms, which is why now you can get allergy meds with Sudafed and things like that in there to really kind of help with lowering the constriction in the sinuses to help you sleep. You may have to take other medications to really block the itchiness and things like that. So typically it's not common to be taking 2 or 3 medications during allergy season because you're getting a good effect of one thing, but it's then causing others, so you have to kind of keep stacking medications. So the importance of that is it's nice to know because the mechanisms, although very simplistic here, can tell you a lot about, you know, are there other maybe natural alternatives that can be helpful in the same situation. I'm not opposed to allergy meds if we need them. I mean, that's going to be important, but it's very common to know people that need to be dependent upon them a lot during these allergy seasons, especially if you work outside, you go to the lake, you travel, you do things like that. It's kind of nice to be able to have a backup so you're not feeling drowsy and exhausted all throughout the day. So as I was saying before about allergies, especially the medications that we use, the typical response is to block the receptors of histamine in the body so that sometimes you don't get the side effects, which actually you do get side effects like the congestion and the sniffling, the runny nose, and rhinitis and things like that. So that's why they're combining medications now these days, the allergy meds, 2 in 1, or you have to take sometimes 3 different medications just to get those wanted effects for allergies. So, in my office, people always ask, is there a way to do things naturally or more preventative that's a little more supportive and healthy for the immune system? And absolutely there is. So I wrote down kind of some of the top ones that I find that I like. One is called Quercetin. It's a flavonoid. You may have heard of that. Actually, what it's been shown to do is instead of blocking the histamine receptors in the body, therefore you get larger pools of histamine floating around, it actually lowers and prevents the release of histamine in the first place, which is great for functional medicine because we try to get to the root of the issue. The bad thing is that it's been shown to not be very well absorbed. So usually we have to take other enzymes with it, like bromelain, which is from the pineapple plant. So keep that in mind, because you want the added effect of bromelain, quercetin, only if you can absorb it adequately. The second thing is called stinging nettles. I grew up as a kid taking this sometimes. It actually is very powerful, and there are some studies that when they looked at a double-blind, placebo-controlled study, how people were taking sugar pills versus like a stinging nettles, they were still getting some benefits of the stinging nettles in supporting their rhinitis. So there was some benefit of that, and personally I know I can attest to that too, because that's one of the big heavy hitters in the natural medicine world, stinging nettles. So very good formula. Vitamin C, we all know the benefits of vitamin C. There's been some, again, good studies with lots of conditions and symptoms, but especially immune boosting for vitamin C. So to get some adequate vitamin C, especially during the allergy season, is just that much more preventative and promoting of the immune system and the proper immune response. Finally, there's n-acetylcysteine. Now that's a compound in the body that's used in many processes, like in detoxification, but helps your body replenish and renew some of your antioxidants, so very important. But it's actually interesting, even the medical studies will show that they do use these in hospitals actually, because it's very helpful as a mucolytic, basically helping improve someone expirate or cough up, mucus and things due to constricted bronchial airways or something like that. So that's very helpful during an allergy response, because if we're going to get that constricted and mucus producing airways, we want to help cough that stuff up. So that's a good way to help kind of naturally do that. So it's good because none of these things cause drowsiness or even those kind of side effects. So that's a good thing. The formula we use in our office, patients say they get about 80% results, which are good results, which is it's a pretty good response. Anybody else who's not getting adequate response from these kind of things, it's usually because there's something else going on internally that we try to investigate. So that's always a good thing too, to always get to the bottom of. So I encourage you to think about your allergies during this time of year, and are there some natural things that could be beneficial to you? And because I think there really has been shown to be some beneficial properties to actually stop the allergy response in its tracks versus kind of blocking other mechanisms that give you more side effects where we have to take a bunch of medications to help block it. So I hope that's been helpful. Please email if you have any questions or need some clarification. And I thank you for watching, and please have a good day.